Hi, my name is Dr. Rudramon, and through the Oral Health channel today we're going to be talking about how your teeth affect the quality of your life. Let's start. So today I'm going to be talking about a very important topic, and this is very close to my heart because I speak to all my viewers very regularly and all my patients as well, and I've understood this pattern especially in the elderly, where there is still a lot of ignorance when it comes to retention of natural teeth in their mouth. So I have to tell you something very honestly. I did my fair share of back-end research about these things, about how the presence of teeth affect the quality of life, and I went through the literature and I got to know some really stark realizations which a lot of us, dentists included, don't understand when it comes to quality of life being affected by the presence or absence of teeth. So when I talk about the presence of teeth, and this is especially seen in edentulous patients, that is the patients who don't have teeth, these are usually elderly patients who actually have gone or surpassed the age of 60. But when I went through the studies and I found out that so many things that have been found out when it comes to quality of life compared with the absence of natural teeth and not replacing the teeth that have been lost have been very exhaustively studied, and some really stark realizations have come to surface. For example, let me tell you something. The quality of life is basically understood as a person's perception of how their life is when it comes to their emotional, physical, mental, social health and well-being, right? So what happens is that most of us, we generally focus on the quality of life when it comes to finances, stability and our medical health per se, but no one talks about the oral health and the fact that when you have compromised oral health in terms of having lost teeth, it really affects your medical health as well. Let me start off with the fact that the teeth help in biting and chewing of the food and sieving it down to smaller particles which help in digestion. Let me tell you something, the very important fact that most of us in the civilized society, in most of the first world or the second world or third world countries nowadays, everyone consumes refined carbohydrates, and carbohydrates are the main source of energy for us. Now, what happens in most of the times is that the carbohydrate digestion actually starts in the mouth with the help of saliva. Saliva is basically your spit or your sputum, whatever you want to call it, and that is actually a function of all the teeth being present in the mouth. If you don't have your teeth present in the mouth, you can suffer from xerostomia, which will therefore decrease the salivary content and the digestion will go down. That means apart from the fact that your bolus and your the food particles are being broken down and then they're going along with the salivary amylase and digesting the starch and the carbohydrates in the mouth, it goes down your gullet. Now what happens in the gullet, I'll like to give you an example of a steam engine. When you see a steam engine, the simple funda or the simple way how the steam engine works is you put hot coal inside a furnace, the coal gets heated up, it produces heat, and then it with the help of water it creates steam. Now that steam creates the exact pressure to keep the pistons moving, and the pistons are connected to axles and all those things, and basically the locomotive starts moving. That's what in the basic thing is. Same thing happens with you. For example, if you consider yourself as the steam engine, your stomach is the furnace, the coal is the food you eat, the acid is the heat or the fire, and the salivary amylase is basically the kerosene or all the solvents that are helping in aiding to burn the coal. Now you also know, if you've had a barbecue at your house, it's very simple. If you have big pieces of coal and you try to light it up, it will not catch fire very soon. It will take a lot of time to heat them up, and then finally they catch fire and then they become warm, or they ignite. But if you break it down into smaller pieces of coal, that gets more surface area to light up, and therefore you can have the fire that you need. The same thing happens with your stomach as well. When the particles are broken down in the presence of teeth, there's more surface area for enzymatic action, more surface area for digestion. Now let me tell you something very honestly, if you don't have teeth, or if you are not able to chew your food properly because of periodontitis and loose teeth, you have undigested food going into your gullet. There will be partial digestion of food here, and then it will go into your entrails and intestines and come out undigested. There have been studies which have been shown that people who have voluntarily taken or swallowed food indirectly or just in toto, the food has come out from the other end undigested. Please try to understand that how important it is. Despite the fact that your machinery might be working all right, but if this is not working, it's not going to help. Secondly, let me tell you something. Once you lose your teeth, your dietary choices change a lot. You're not able to have meats, you're not able to have vegetables, you're not able to have proteins, you're not able to have fruits. Now, fruits and vegetables are natural sources of a lot of minerals and vitamins and a lot of substances that help in protecting your body from a lot of diseases, inclusive of cancer. Trust me, especially the fibrous fruits and the vegetables. The fiber helps not only in increasing the gastric motility, helps in digestion, lowering the pH of your stomach, making sure that you don't get acidity, you don't get gastritis, you don't get peptic ulcers, duodenal ulcers, irritable bowel syndrome, Crohn's disease, intestinal polyposis, diverticulitis. The list is endless, and all that works is because of the fact that you're not able to eat fiber, because of the fact that you don't have enough machinery in the mouth, that you cannot chew your food properly. Please try to understand that's very important. A lot of the four main things apart from carbohydrates, you have minerals, vitamins, proteins and fibers, apart from fat as well. Now what happens is when you're edentulous, that means you don't have teeth, you go for more starchy food, you go for more fatty food, that leads to increase of your cholesterol levels and therefore predisposes you to cardiovascular diseases, heart attacks, so many other things, metabolic syndrome, diabetes, insulin dependent diabetes mellitus, that's also there, it increases the insulin resistance. Secondly, when you take less of proteins, your immunity goes down. When you take less of vitamins, your protective immunity goes down, your oxidative stress becomes more. When you take less of minerals, your calcium density goes down, your acidity increases. The protective role in terms of immunity, infections, cancer protection, everything goes down because of the lack of fiber, the lack of protein, the lack of vitamins, the lack of minerals, the lack of trace elements. That happens because you're restricting yourself to the amount of food, whatever you're taking, because of the fact that you're not able to eat. Now coming to the second point, quality of life is just not around the nutrition and medical thing. You can't speak properly, especially consonants like or sounds like f, v, t, s. All of these require your incisor teeth to bite together. In patients who have periodontitis and lose their molar teeth, what happens is they tend to collapse their bite and start biting with their front teeth. Now the front teeth are not supposed to bite into hard objects, not meant to bite into fibrous foods, and that's where there's trauma from occlusion, and that causes the front teeth to also start wobbling, and then they lose the teeth, the patient loses their teeth, and then they become completely edentulous. Please try to understand that tooth replacement is very important, especially around the last thing that I would want to say is quality of life. For any unfortunate reason, if you ask a young person the quality of life when it comes to teeth, just ask them if they've lost their teeth and they will start crying in front of you. There are so many videos on social media about people who've gone through any sort of drug abuse or any sort of debilitating disease in life that has left them lose their teeth at a very young age, and their confidence strips down, and the moment the dentist gets them the prosthesis or implants or anything of that sort that replaces that edentulous smile into a teethy smile, that really brings out the emotions in their hearts, and they feel alive again. That's what I'm trying to say. Now I understand that a lot of people have gone who were post 60, they really don't give too much about it, but to be very honest, if you're a caregiver, if you're younger, if people who who are above the age of 60 or even in the middle age group and who lack teeth, please motivate them to get their teeth replaced until unless it is contraindicated for implants such as diabetes and systemic diseases, which are contraindications. Otherwise, dentures and so many other things like fixed prosthesis can be used to get the smile and the confidence back for all those patients. So that's it for today. This was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, this is my WhatsApp number, my social media handles. Please try to refrain from calling. Drop me a message and we'll have a word. And if you have any queries, apprehensions, criticisms, doubts or suggestions, please feel free to leave them in the comment section. That's it for today. Thank you.